I'm very pleased to introduce Ms. Goldsack. She earned a master's degree in chemistry at Oxford before representing the United States in the 2008 Olympics in crew. She also earned master's degrees in business administration and history and sociology of science. Spent 5 years managing projects for CTTI, the Clinical Trials Transformation Initiative, and comes to us now from Florida as the Chief Executive Officer of the Digital Medicine Society. She'll be talking about data security, a topic I'm personally working on in multiple projects, so looking forward to this. Over to Jennifer.
Neil, thanks so much. I'm really delighted to be here. Let me just go ahead and share my screen, and maybe you can give me a thumbs up when you get it.
Got it.
You got it? Terrific. So hi, everyone. As Neil said, my name's Jen Goldsack. I'm the CEO at the Digital Medicine Society, or DIME. For folks who may not know DIME, we are a 501c3 nonprofit dedicated to advancing the safe, effective, ethical, and equitable use of digital technologies to optimize health. As part of that, and echoing a lot of what I've heard from sort of previous speakers, we are certainly enthusiastic about the promise of digital clinical measures, including sort of wearable tools that capture those data, to really reimagine how we define health and disease. We're no longer reliant on these snapshots taken in clinic, and the volume of data, the sort of holistic nature of that data vis-a-vis every individual's life is impressive, important, and as we said, really does set us up to be able to sort of reimagine these definitions of health and disease. So excited about it have we been. We've actually spent a lot of time developing evaluation frameworks to help us understand whether these sort of digital measurement products, again, including wearable technologies, are trustworthy. When we think about what that entails, what the question of trust actually means vis-a-vis these tools, we think about a number of things. We think about sort of the quality of the measurement process. We've unpacked that into a sort of stacked V3 framework to think about verification of the sensor, analytical validation, which really thinks about the algorithms that are being used to process that sensor data into something that we can understand from a feel or function or biological performance point of view. Importantly, that analytical validation isn't just thinking about the performance of the algorithm in a subset of individuals, but it also helps ensure that those algorithms, for example, perform equally well across different skin tones, across bodies of different ability. There's a lot in that analytical validation that we have to pay attention to when we think about trustworthiness. The other piece, of course, is clinical validation. Once we have this data point, once we have this information, is it actually meaningful in a clinical context? And if so, how? Security, which is going to be the focus of our conversation today, is a critical element of sort of trustworthiness when it comes to these wearable technologies. So too is thinking about the data rights and privacy of all of these sort of high velocity, high resolution data flows that come off these sensor technologies, these wearable products. We have to think about utility and usability. I think oftentimes we think about how the individual at home may enjoy or struggle with these sort of technologies. I think it's really important too to think about how our clinical colleagues experience these, how it fits into clinical workflows, and increasingly importantly, how do our sort of biostats and data science colleagues find the data? Is that data usable? Does it have utility? For anyone who has anything to do with software architecture, you're thinking about how you receive these data. These are not easy questions, and they really sort of lead into the suitability and the fit for purpose sort of nature of any given wearable product. And then, of course, economic feasibility. It's probably possible to build the perfect or near perfect product, but can we do it at a cost that individuals and society can afford? That's been something we haven't been terribly good at with healthcare generally, and we need to focus on it vis-a-vis these wearables. So, as I said, the focus of the conversation today, of our discussion, and hopefully we'll have good time for sort of lively discussion at the end of my presentation, is around security. And I really want to take a moment to sort of distinguish between security and some of these other elements. So when we're talking about the security of a product, and particularly of the data, we're really thinking about preventing unauthorized access to the technology, to the software that runs on it, and to the data it produces. As it pertains to the data, security prevents theft of data. For the purposes of our conversation, I actually want to spend a couple of minutes distinguishing sort of security from aspects of, and I think I skipped over a slide here, data rights, privacy, and governance. When we're thinking about sort of data rights, when we're thinking about privacy, we're thinking about authorized access to the data. Security is the unauthorized access. Data rights, privacy is about the authorized access. And really, a lot of what we've talked about, even Dana just now was saying, you know, we need to make sure that the appropriate people do have access to their data. We're not just thinking about limiting it in these cases, whether it's patients themselves, whether it's the clinicians who are charged with taking care of them, whether it's individuals sort of making public health decisions, whether it's researchers. Who do we want to have access to these data? And critically importantly, do they have permission from the patients, the appropriate disclosure that they are allowed access to that data? That's all part of this conversation. There are also risks associated with sort of broad access to data. And I want to spend a couple of minutes there before we return to our conversation around security. And I thought the best way for us to start would be to consider an example at the intersection of sort of security issues and privacy issues. And actually, I want to flag the work of a brilliant organization, the Light Collective. They have done an awful lot of work thinking about the protections available to patients and peer support groups that rely on social media platforms as a place where people can find support. What they just discovered was the sick girl vulnerability. So for folks who may not be aware, all systems have flaws. When those flaws actually end up disclosing user information, in this case for a patient group, patient information, we describe that as a vulnerability. Some examples, we can think of Cambridge Analytica exploited a vulnerability. However, we can also learn from our colleagues at the Light Collective that for patient groups, vulnerabilities have been exploited, particularly around private patient groups. There've actually been access to these things. Colleagues at the Light Collective reported this to Facebook, and this is where we sit at the intersection of sort of the security piece and the data rights piece. And Facebook responded and said, oh no, this isn't a vulnerability. This isn't a flaw. This isn't a security risk. This is a feature. This is how we enable our advertising. And so they said, no, this isn't a security issue. This is a data rights issue, an unacceptable data rights issue. But it shows you how these two paradigms sort of exist together. And it's important to think about unauthorized access, which is a security issue, versus pretty poor disclosure of what is authorized as being a data rights issue. Let's dig on data rights for just a moment longer before we go back to the main point of our discussion today, which, as I said, is around sort of data security and the security of these wearable technologies generally. A lot of these data are being generated from new sources, a variety of different sort of wearable sensors. A lot of that happens outside of the clinic. It's in consumer products. And it's not just, and in fact, let's take it a little bit further. Let's think about what your OnStar knows about you in terms of your weight. Every time you get into your car, it's measuring that. It knows what you weigh. It knows that you may go to the liquor store every night after work. And we can triangulate that with what you might be searching for on the internet. We can make strong inferences from all of these data that now exist digitally and can flow. How are they protected? Quite limited protections exist. As I said, even when it comes to wearable sensors, a lot of these are captured outside of a direction or an instruction or a location with a HIPAA entity, and so they're not covered by HIPAA. There are quite limited protections in the US around how our data are used, how they are accessed. Again, this is not a security issue, this is authorized access, but it's important for us to be aware of the intersection of these two things. And before we return to security, I do really like this quote. Health data in particular is incredibly valuable. Health data, if you buy it on the black market, you are paying more than you would do for banking data, for example. And this tweet from a long time ago now, September 2010, and cross-posted from Facebook, I don't think anyone does that anymore. The rule of thumb is if you're not paying for it, so a given app, a platform, a service, you're not the customer, you're the product being sold. And I think the intent here is really to dive into the data that you are producing through your daily activities. That's the product. And while you might not be the recipient of the funds, someone is likely selling that data. Let's get back to the sort of a main topic for our conversation today, really thinking about sort of the security elements or sort of around and supporting these wearable technologies. And I think it's important to look at the broader landscape of the sort of digital era of health as we consider security. There was an enormous and coordinated cyber attack of healthcare systems and hospitals, mainly across Europe several years ago now. The attack was known as the sort of WannaCry virus. And several years following sort of that incident, where in the UK in particular, a number of patients actually died. Specifically, it was sort of emergent stroke patients when their care teams couldn't access their medical records, actually passed away as a result of this. Huge shutdowns, huge expense. Absolutely sort of catastrophic for the period while the virus was going on. What we find is several years later, at the vast majority of trusts, which is how UK health systems are broken down, still don't have a single security researcher or cybersecurity expert on staff. And I think this reminds us that memories are short. I think this reminds us that this is something that many of us with a clinical background understand poorly. I think this reminds us that, you know, out of sight, out of mind, and while it's going well, we may not be thinking about security, but it is absolutely critical. And it's funny, it always amuses me that this is so far from our psyche, because we've seen it all over the place. This is actually a really good Forbes article that was written just after an episode of Homeland that some of you may remember, where I think it was the vice president, maybe, they remotely hacked their pacemaker. And the question was, gosh, that can't happen, can it? I mean, feasibly it could. And we'll get to that a little bit later. And so sort of we tell these stories, and yet how seriously as a sort of community we take the need to better partner with our sort of security research colleagues, we aren't sort of heeding all of these signals. And, you know, while this is a great story, and isn't it nice that it was on a primetime TV show, this, that, and the other, you know, this is not static. The security issues and the security risks don't just apply to sort of technologies we may be accustomed to and our wearables, but actually, you know, we're in an era where tech innovation is moving really quickly. We're going beyond the Internet of Things to the Internet of Bodies. We can start to think about sort of implantable technologies. We can start to think about, you know, how do we handle security of something where rules, policies, procedures may be updated? What if something's implanted in your body and then the company goes out of business? Who's in charge of monitoring the vulnerabilities, of conducting the patches, implementing those patches remotely? These are all really important questions, and it's right at the leading edge of sort of technology and legal scholarship. I've got a Wall Street Journal article here on the screen, written by a legal scholar, Andrea Matwishin, an absolutely tremendous piece that will blow your mind. And if you haven't read this yet, strongly recommend you dig this one out. So, you know, I've painted a bit of a dramatic picture about the risks here, and that's intentional. And one of the things that increasingly we talk about among the digital medicine society sort of community is the idea of really redefining sort of security risks as a safety issue. Why? Because when we talk to our clinical colleagues, we are well programmed as a community to minimize safety risks, to minimize harms. And I think it's really important that we change the narrative, that we stop finding it acceptable to forget security risks, and we really try and change the conversation. I would make the case that we need to think about security risks as being safety risks in the digital era of health, and as we promote the use of sort of wearable technologies to measure and intervene in health. Let's talk a little bit about sort of how all of this applies to wearables. We've been at a bit of a high level, and I think that's really important, because a wearable in and of itself doesn't exist in a vacuum. It's part of a broader ecosystem, a broader digitization of our daily lives and of our health and healthcare. So, you know, what are the risks? So let's be specific when we come to sort of wearable technologies and securities. So once these things are connected to the internet, as the vast majority of them are, the risks come from a sort of actor being able to attack and access the product remotely, right? That's our Homeland example. That's really changing the way that these products are functioning. Oftentimes the risk is in real time, so there's very little that anyone can do to prevent that once that vulnerability is identified and exploited. Cybersecurity is a field where we really think about how can we best protect these internet connected systems, including wearable technologies. And again, from that unauthorized access, that's the definition of sort of security. It's also really important to think that, and this is a theme that we'll visit again and again during the course of this conversation, it's not just a tech problem. All of these tools, these technologies are being used by, are overseen by, are managed by humans. So it's not just tech vulnerabilities, it's also things like user errors. And the example here on the screen is, if you have access to a sort of database of these sort of products, or if you tether your product to a laptop or your phone and you lose that, right? This is still unauthorized access. They're a little bit less sexy and a little bit less techy, but we still need to think about it. And so the question is, who's in charge, right? When we think about the security risks we've spoken about in the digital era, who is the regulatory agency that is charged with sort of overseeing us and keeping us safe? And actually, it's a sort of coordinated effort across a variety of different agencies that are in charge of setting the standards. And as we think about the era of sort of wearable technologies in healthcare, not falling squarely into the purview of healthcare, like a lot of these come from sort of consumer sort of backgrounds. Dana had great examples of how her and her citizen scientist, patient colleagues have been innovating. Right, the oversight of these products is very much distributed with, in some cases, sort of differing standards. This is challenging for us to keep up with, although it's not unique to the US. If we look at the sort of patchwork of regulations across Europe, we see something very, very similar. This is not an easy topic. We'll see that sort of, various pieces of legislation vis-a-vis sort of products and then access to the data itself are overseen by different agencies, whether here in the US or whether abroad. What do we do, right? How do we actually handle this? For every one of us sort of listening in today, how do we think about tackling this as we sort of try and promote and try and advance the promise of wearable technologies to improve lives? I think the most important thing to do is sort of educate ourselves. And I'll give you an example. I can't tell you how many times in any given week someone says to me, just tell me what wearable we can use with our patients, or I can use for myself, or I can use in my study that's unhackable. And it's, in this day and age, that's almost an impossible question, right? Anything that connects to the internet, even via a wire, if it's on that system, then it can be hacked. And I think being eyes wide open to this reality is really, really important as individuals advancing the field. I also think it's really important in many ways, sort of fundamental to this new digital era of health, to recognize that there are experts outside of the traditional clinical sphere who know exactly what they are doing. And, there's a lot of talk about, hackers and, is this someone sitting in their mum's basement? Not necessarily. Yes, there are nefarious actors, very, very bad in some cases. They would be your black hat sort of hackers. But really, we are interested in the security research community. And I think it's incumbent on all of us to embrace them as part of the healthcare system, as part of the healthcare innovation ecosystem as we move into this digital era of health. We absolutely need their expertise, and these are not new problems for them. In the same way that people get very worried about, what about the safety of this, that, or the other. I would challenge sort of anyone in the audience to tell me that they don't use a banking app, right? These questions have been asked and answered in other fields. The expertise exists. It's incumbent upon us to make these experts feel welcome in our community. And, I'm certainly not the first to say this. Our FDA colleagues, I think, are absolutely leading the way when it comes to partnering with and providing sort of relationships with and resources for the security research community. There's an initiative called wehearthackers.org, which I encourage all of you to check out. Also, FDA are sort of participants, regular participants and leaders within the Biohacking Village at DEF CON, which is an extraordinary community that really does convene the strongest security researchers to aid and assist in sort of developing medical products in the digital era of health. Our FDA colleagues also make a variety of resources available. Their cybersecurity team is sort of best in class. And I encourage, again, anyone who feels like they want to continue their education around sort of security risks and solutions in the digital era of health particularly as it pertains to wearables and medical devices, to access these resources. And, you know, while we may not be the best at welcoming our security research colleagues to the clinical community, they are very open to welcoming us, to teaching us, to collaborating with us. And I've thrown a couple of groups here that certainly at Dime we partner with, are proud to partner with, and recommend to everyone we work with. There's a group called I Am the Cavalry. I'll show some of their work later. And also the Biohacking Village, as I said, at DEF CON. They are a thriving community of folks dedicated to making sure that the security of sort of medical products is absolutely top notch. They are very, very collaborative, and I encourage all of you to reach out to them. So we've got to think about the resources already available. We've got to think about the partners who already exist. We've got to think about the responsibility we have to educate ourselves. Let's dive into that a little bit more. There's a really tremendous Nature article that I'm sort of drawing from on the slide now. Security isn't a one-touch thing. And when it comes to these sort of medical devices and particularly wearables, it's really important to think about where vulnerabilities may occur. It's a multi-stack issue. We can think about sort of the parts that go into it, the compound parts that build a wearable. How are we thinking about best practices as we assemble these goods? And then critically, remember we said the human element is really important. It's not just in the manufacture of these technology, particularly because they're dynamic with ongoing software updates. We have to think about their operation out into the field. Also, I will make these slides available. I'm sharing a lot of resources, which I think underscores the fact that there are a lot of resources available for us all to learn. And these will definitely be available sort of after our conversation today. We have to think about the full stack of the product development and operational lifecycle. What else do we need to think about? Some of the sort of questions you may want to ask would be around coordinated vulnerability disclosure policies. What does that mean? It means at the moment at which an organization, whether that's the manufacturer themselves or the white hat hacker who's sort of probing these things and trying to keep us safe, that there's a policy by which we disclose that. We're not burying that. We're not hiding it from patients. We're not hiding it from regulators. We're not hiding it from clinicians. We make that known, and it also and we drive towards a patch, a solution as quickly as possible. I think it's really important to ask manufacturers of these wearable technologies, does your security support last a lifetime? One of the things that many of us, even in our sort of consumer technology choices, have been accustomed to is, you know, over a period of time, software versions may stop being supported. In fact, if you go back to the WannaCry issue, that was part of what happened there with a suite of products that were nothing to do with healthcare, but they were connected to the internet and they were part of the healthcare system. You know, is there a commitment from the manufacturer, and are they committed to pushing the updates as soon as they find that these things are available? And then importantly, and going back to that sort of full stack I showed you on the previous slide, does the organization track and share a software bill of materials? And again, I can't sort of recommend enough that manuscript. There's also sort of ISO standards that pertain to this. Again, these are not new issues. Our sort of hardcore medical device colleagues know this well, and the security research community that have been serving the digitization of many other industries are absolute experts in this. And then, you know, it's one thing knowing the right questions to ask, you have to know the answers, right? So we would expect those coordinated vulnerability disclosures to be made public and notification when they're addressed. We do want to see software bills of materials, and we do want to make sure that these software bills of materials and other documentation is kept up to date and made available to every user of the product, not just the buyer who happens to sit within a healthcare system perhaps, but every individual who is touched by and uses these products. This should be open access information. This should never be hidden. Again, emphasizing the amount of sort of resources that exist on this, I want to highlight the tremendous work by the US Digital Service. Their digital services playbook has extraordinary materials, particularly in Play 11, around how to manage security and privacy through reusable process. Interestingly, this doesn't target sort of wearables or medical devices, but we can draw heavily on what they've done. Security best practices sort of apply across different sort of disciplinary and use case silos. And even within GDPR, which folks always think of as being sort of data privacy, there's really tremendous resources that exist vis-a-vis sort of the security of the different data that are generated by wearable technologies. colleagues, my erstwhile colleagues, in fact, as Neil's reminded us, at the Clinical Trials Transformation Initiative, a public-private partnership co-founded by Duke and the FDA, have a tremendous resource that I've got on the screen here around securing data, specifically those generated by mobile technologies in clinical research. So a lot of this is focused on wearables. This is a tremendous resource that I suggest everyone looks at. But, you know, we can have all the toolkits and the toolboxes in the world that we like, but I think it's really, really important. And this Forbes article is absolutely tremendous and highly recommend you taking a look at it. This is not just a tech problem. And because it's not just a tech problem, we are not going to tech our way out of this. We can have, you know, tremendous pieces of software and updates and this, that, and the other, but ultimately there's still a really important human component around education, around ethics, around attitude, around sort of skills when it comes to high quality security as it pertains not just to wearables in healthcare, but that's the topic for today, around sort of connected technologies across the board. And, you know, something that I find really interesting and over time I've become a huge proponent of is thinking about how we prepare our clinical colleagues to engage in the healthcare space. You know, we think about the Hippocratic Oath, which, you know, is something I have to get off my chest. This doesn't anywhere in the Hippocratic Oath, I don't believe, although I'm sure someone will tell me in chat if I'm wrong, never says do no harm. But what it does talk about is embracing science. What it does talk about is the broad benefit of the practice of medicine. What it does talk about is actually privacy. Even going back to 400 BC, we were talking about the need for privacy. And, you know, how can we think about the fact that we ask our clinical colleagues to swear a Hippocratic Oath? In the digital era of medicine, our tech colleagues are just as an important part of sort of the community. How can we think about the equivalent of a Hippocratic Oath for sort of our technology colleagues? And this is something that I Am the Cavalry, a really tremendous organization, have actually advanced. And I've put some of the principles that they recommend as part of their Hippocratic Oath for connected devices up on the screen here. Cyber safety by design, third-party collaboration. That's certainly been a theme of my talk today. The need for evidence capture. Digital health should advance as an evidence-based field. We need to be sort of resilient. There needs to be containment practices. And of course, cyber safety updates. This is a dynamic field. We need to keep pace. This is part of recognizing new colleagues in the digital era of health. And I applaud our sort of security research colleagues for leading with this. And for anyone who has qualms about engaging with the security research community, I hope that this allays your fears. They certainly are leading with sort of the highest level of thought, evidence, and ethics here. And let's zoom out one step. I think it's really important to think not just about the role of our sort of security sort of research colleagues, although as I've emphasized, they're critically important. Let's think back to Dana's conversation and how she was telling us that as a patient and citizen scientist, how she's been able to sort of connect the field. Let's think about that lab at up in Chicago, right, where you know, the strongest technologists are now partnering with leading clinicians and are developing high quality tools. We really need to redefine what sort of workforce we need in order to have success in the digital era of medicine, in order to bring the promise of all of these wearables to bear on our watch. And, you know, this is something, actually, I had the privilege of sort of building this framework on behalf of the DIME community with my colleague, Dr. Cole Zanetti from the VA. And what we recommend is that there needs to be a skills pivot. We need to start thinking about or take a sort of big tent thinking approach to welcoming all of these different colleagues, new technical skills alongside traditional clinical competencies, and really sort of recognizing that digital health is likely the most multidisciplinary sort of field if we want to be successful. We need to think about not just sort of welcoming folks in the current workplace. We need to do a better job of training the future field. We need to think about integrating clinical and technical skills to really sort of educate a future bilingual workforce who may be experts in one or the other, either clinical or technical, but understand the language, the values, the approaches of their colleagues, sort of on the other side of what currently feels like a fence. We also need to make a commitment to diversity that goes sort of beyond lip service. There have been sort of horror stories, even of wearables, where, you know, the software product that you might want to run on data from your wearable that goes on your phone, it's so enormous. Unless you have the top of the line, biggest data storage iPhone, it's not going to work for you. We need to think about embracing people from all walks of life into this field, reaching out to them, upskilling them. We need to make sure that the digital health workforce better reflects the patients that we're all here to serve. We haven't been terribly good at that in clinical medicine generally. We haven't been terribly good at that on the tech side of the fence either. What are we willing to do as a new and emerging field in order to really think about our workforce, as I said, and I think it bears repeating, a workforce that better reflects the diversity of all the patients that we're here to serve? A couple of things I want to do to round us out before we dive into sort of question and answer and hopefully some really good discussion is I want to revisit this idea of sort of redefining patient safety. This was a drum I sort of banged for a while, really thinking about the need to redefine it, and actually did a lot of work, including with a tremendous colleague, Dino Mendelsohn at Human First, thinking about, what are the safety risks in the digital era of health? And, I'm often wrong. What I did was I actually went to the definition of patient safety from the World Health Organization, and it's up on your screen now. And I actually don't think we need to redefine it at all. And I've highlighted some elements here. I think we just need to put it into the context of today's reality as we try and use these wearables in healthcare and during the digital era of health. Patient safety is the absence of preventable harm, right? And we've been talking about the risks of harm from these sort of insecure wearables potentially. The definition of patient safety talks about the reduction of risk of unnecessary harm. I don't think we understand the risks sufficiently. I don't think that either, patients themselves, because we haven't taken the time to educate them, but we haven't taken the time to educate ourselves. We need to minimize preventable harm, but first we have to understand where those risks of harm exist. We need to educate ourselves. And, the collective notions of given current knowledge, resources available, and the context in which care was delivered. The beauty of these wearable technologies is that it sort of blows away this notion that care is only delivered and administered within the walls of a clinic. I have this vision of a future state of healthcare where not only are we using these sorts of technologies to redefine health and disease, but we're redefining the management of health. Again, I keep referring back to Dana, but her presentation was so compelling. How do we think about getting that flat line that Dana achieved in her sort of glucose levels? It didn't happen in the clinic, right? And so the context in which care is delivered has vastly changed. It's now a connected world. With that comes security risks. And we need to be aware of those risks in order to reduce sort of allied harms. And then I'm actually just going to play a video here where I talk about some of the work that we've done at Dime, particularly one of our flagship sort of outputs called the Playbook that really focuses on digital clinical measures. And I did say we'd done a lot of work on this and I wasn't sort of over-egging anything there. Some of the work that we did as part of sort of developing the Playbook, which is not only a 100 and something slide, 300 and something slide deck that talks you through everything you need to think about when developing and deploying digital clinical measures, including wearables in the context of sort of public health, healthcare, and health research. We also developed over 100 allied resources. Part of that is a manuscript that I was fortunate enough to co-author with Jessalyn Dunn, who I actually think is, I think Jessalyn, I saw you on the line, so I'm glad you're here, that we actually looked at what is the state of academic research vis-a-vis sort of digital clinical measures, again, including wearables. This is available in preprint now at the link at the bottom, and later in September, it's now been fully accepted. This will be published in JIMA. And over the last 2 years, we can see all of the academic studies that have been published vis-a-vis digital clinical measures. We can see really strong work and verification, analytical validation, appropriate measure identification. That's good. We're measuring signal, not noise. Clinical validation, great foundation. One publication on security concerns vis-a-vis digital clinical measures and sort of wearables in healthcare. One, as it pertains to sort of data rights and governance, and think about all the things we were talking about in terms of privacy and security. Not a single paper is focused on solely the ethical elements of these tools. And, this paucity of research on some of the most critical elements in order to reduce risk, minimize harms, and ensure that we have trust, which once we've lost it, we will not get back. when it comes to using these wearable technologies, this blows my mind. This is alarming data that I want us all to take note of. How can we educate ourselves if the research around security vis-a-vis these wearables doesn't even exist? And another really important element in this sort of research that we conducted was around how are these sort of studies being funded? We can see that a lot of this is happening through sort of lab-based research. Government funding is strongly supporting this sort of foundational, does this sort of widget measure what it say it's going to measure? That's terrific. It's work that has to be done. I'm not criticizing that. I mean, on the one hand, yes, 100% of the security research was funded by government, but frankly, I'd like to see a lot more RFAs vis-a-vis security, vis-a-vis data rights and governance, vis-a-vis ethics. None of this is going to work, and we are going to lose the trust of the very patients we are trying to serve unless we get this right. And so, you know, as I sort of wrap up and I look forward to some conversation, I think it's really incumbent on all of us to embrace our security research colleagues, to educate ourselves on what these new risks and harms are, and to make sure that we are sort of taking a sort of security by design approach and asking thoughtful questions about security when we start relying on these technologies and these flows of data that sort of across the board are connected to the internet. And as we learned today, if it is connected to the internet, it can be hacked, and let's take that threat seriously. We want to realize the promise of these new technologies, but we can't be eyes closed to the risks. And with that, I'll stop sharing. Niels, and hand back to you to take us through some questions from folks on the line.
Awesome. That was a really great presentation. How does an average user educate themselves whether a particular company meets any relevant data security standards?
It's not easy. That's why a lot of what you'll see around sort of what we were talking about sort of coordinated vulnerability disclosures, software bills of materials, leading companies will post this information. Sometimes the information isn't posted. It's not become a standard. No one's insisting on it. And it's actually really hard to think about. It's really hard to sort of know if that information isn't even mandated as being available. So, you know, I think there are basic security practices we can all take. Silly things like password protection, silly things like, you know, the way that we sort of interact with the variety of other tools and technologies that our wearables are connected to can help keep us safe, right? All of those things are actually an entry point because it's connected. But right now, honestly, Niels, it's a really difficult question to answer because we're not terribly good at disclosing that information in the first place.
Following up on that, are there any other classes of concern that the consumer should perhaps be entitled to, like whether or not their data is being flowed to a foreign investor?
So entitles a really hard word. There's no law that entitles anyone to that information right now, for a start. You know, whether it's my opinion that you should be able to find that information, yes, absolutely. I think it's really important to remind ourselves of sort of what flavor of problem is that. That's not a security issue. There's something like, if you read all of Amazon's terms and conditions, it would take you like, at this point, it doesn't even matter because you're not going to do it. It's either 9 weeks or 9 months, and I can't remember, and I'm embarrassed. But whatever it is, no one's sitting down to read the whole thing top to bottom, and they're not written in sort of lay language. It's a lot of legalese. It's a lot of caps everywhere screaming at you legal terms. It's very, very hard, even within fully comprehensive sort of terms of service, privacy policies, to actually figure out where your data is going. But the chances are somewhere in a document at some point you scrolled through the first 3 pages, tried to do your due diligence, and then just clicked, for the love of God, I accept. It would disclose that. And, you know, one of the really interesting pieces in Europe is that, or pieces of legislation in Europe that I think, or I would love to see the US embracing a little bit more, is if you refuse a sort of privacy policy, for example, in the US, you can be denied access to the service, right? So if you say, absolutely not, I don't want my, I don't know, you know, data from the X social media platform flowing off to foreign investors, or from my widget flowing off to foreign investors, I shan't click, then you can't access the product. Actually, legislation in Europe means that you still have to be granted access to the product, and they have to abide by your preferences. So there's a lot more user control. And, you know, this comes back to, sorry, Niels, I'm giving a long answer, but as you can tell, I get fired up about this stuff. You know, this comes back to the idea of sort of access. We could take all of the health data and just bury it in the back garden. You know, essentially that wouldn't be that different to what we've done with it for the last decades, right? It's been locked in a file cabinet in a manila folder. We haven't been able to learn. We haven't been able to do, and as I said, I keep going back to Dana, but it's such a sort of compelling example. We haven't been able to provide patients. We haven't been able to provide folks wanting to build a learning health system. We haven't been able to provide sort of folks overseeing a public health crisis with that information. Now data exists in a way that we want to provide access to it. To sort of trustworthy individuals, but we need to create opportunities for the individual users of sort of, you know, the wearable or whatever the data source to be able to sort of grant those permissions, be fully informed about it. And we should be able to look, although we wouldn't do it, we should be able to look every user we ask to use one of these technologies in the eye and say, we've done absolutely everything we can to prevent unauthorized access to your data and also to the tool that you are using. That's the security piece, and we're not there yet.
One on the flip side, as a clinician, you know, is there any, you know, I worry that some folks may want information that I may not have. They may assume that I have access to data from their wearables, and there's a discovery problem where I have no idea what they may or may not have. Conversely, data that may be in my system eventually will go and be made available for secondary research as approved by an institutional review board. And even telling the patient that I have, or the institution has shared that data, may violate certain aspects of the patient-physician relationship. So I'd be interested in your thoughts, you know, briefly or maybe offline somewhere on how to tackle these sort of discovery problems on both sides.
Yeah, and I mean, it's a really good question, and I'm not sure there's a perfect answer yet, although I encourage anyone with thoughts to sort of pop this in. I think at this point, what I would point to again is the leadership of our FDA colleagues. Over the last 2 years, they have been intensely hosting sort of listening sessions. Their Patient and Family Advisory Council have been listening to a variety of different medical product developers, of sort of algorithm experts, of privacy experts, of security experts, and really thinking about, hey, if we do have a sort of digital health product and we do understand, or we do hear that there's a vulnerability, how should we disclose that to different parties? How should we communicate that with clinicians? How should we support them in having conversations with patients? Should we communicate that directly to patients? Should they hear it via their doctor? Should, at the point of sort of engaging with one of these technologies, should you make that selection a priority? A variety of different experts have been presenting to CDRH's sort of Patient and Family Advisory sort of Council and really having hard conversations about this, but thoughtful conversation, patient-driven conversations, recognizing the challenge that I think, Niels, you and your colleagues as clinicians are facing when you're asked questions to which you haven't been trained on and you don't have answers because the widget company hasn't given you the information. I'm not sure we're at answers, but there is a lot of work being done to drive towards this and to try and keep pace with the questions that you face during routine appointments every day.
Awesome. To be perfectly honest, I'm struggling with my Q&A application here, but I think we've covered the questions. Are there any other, we may have touched on this, are there any other efforts at harmonizing data between environmental sensors and digital health wearables? So I guess one example I might think about this is, you know, does my Nest thermometer feed into my wearable health, and, you know, can I make it warmer to sleep better?
Should. So certainly the capabilities are there, right? And I go back to sort of where are we in digital health? Great question, by the way. Where are we in digital health, sort of vis-a-vis sort of healthcare or digital innovation elsewhere? We do this all over the place. I gave the example of like, we can integrate data from, I have an old beta of a car, so I actually don't have an OnStar system, but you could use your car's OnStar system. You could use your GPS. There are certainly people out there who are integrating all of that data. How can we do that for healthcare? Certainly, we insist on a higher sort of rigor in terms of data authenticity and integrity before we start making decisions on it. But it is absolutely possible to think about combining this sort of more clinical information that you might get from, I don't know, from sort of the heart rate sensor with location data, with pulling snapshots from NOAA around, you know, what are the conditions in the air, like what's the temperature, what's the humidity level in your house. All of these things are absolutely possible. Depending on my mood, I'm back and forth with sort of where we are on this. Sometimes I'm like, just get the simple things right first and figure out how to do a simple clinical workflow with a continuous glucose monitor before we start like triangulating off sort of the North Star. But, all of these things are possible. And I think this comes back to my call to action, which is we have to do a lot better at realizing that the traditional clinical establishment is not going to do any of this on our own. We need to start embracing the skills and the capabilities of our data science colleagues, of our standards colleagues, of sort of our ethicist colleagues. A group I should have called out is sort of Recode Health down at San Diego University, overseen by Camille Nebeker. They do tremendous stuff vis-a-vis sort of ethics in this sort of research. If we can bolster all of these groups, if we can embrace all of these groups, if we can sort of recognize that this is multidisciplinary, we're going to be able to advance towards these things much more quickly and not still be banging our head against the desk in 5 years when we still can't get the CGM data in or know what to do with it or know what the workflow is or know how to pay for that care.
And last question, I think from Tim Clark, are approaches such as federated learning and other privacy preserving machine learning approaches gaining traction in privacy advocacy communities? So are patient groups tracking these sort of more advanced methods like differential privacy and federated learning?
There absolutely are. And there are a couple of different sort of methodologies, federated learning being one that's very viable, that are absolutely on deck. I think it comes back to a little bit about what I was saying around sort of the funding for these things, like who's in charge, right? If we want to start creating these federated data systems, who oversees them? Who is the actor that is most trusted by the public, that as appropriate when a pandemic hits our shores, grants the appropriate access following consent through a federated system, who maintains the security of that system, who's checking the integrity of those systems. These things don't happen for free, and you can't put any old person in charge of that and ask the general public to trust it. So, I actually commend our patient groups. They are always the leading edge of this. We've started to see this within individual sort of therapeutic areas. What I would say is, one, we over rely on our patients to solve our problems for us. They have been screaming into the wind with good ideas, and we need to better support them with money and with expertise. I would also argue that we need to make sure that we don't create new silos in this digital era. If we start passing these things out by therapeutic area, for example, before we build these things, we're just creating a whole new mess. We have a lot of lessons learned over the last few decades with using things like EHR and a variety of other different sort of technologies. How can we be very, very intentional at this juncture? And this window will only last a few years to build the systems that actually support what we've been talking about for a decade, a true learning healthcare system at the population level.